Welcome to Pediatric Case Review. Today's lecture covers Down syndrome, providing a comprehensive clinical overview for healthcare professionals. We will discuss characteristic clinical features, diagnostic approaches, common complications, and evidence-based management strategies. This intermediate-level presentation will enhance your understanding of caring for patients with Down syndrome throughout their lifespan. A term newborn presents with generalized hypotonia noted immediately after birth. The pediatrician suspects a genetic condition based on physical examination. Which physical finding is most characteristic of Down syndrome? Option A, macroglossia and posteriorly rotated ears. Option B, single palmar crease and upslanting palpebral fissures. Option C, micrognathia and clenched fists. Option D, elongated face and large protruding ears. The correct answer is B. Down syndrome presents with characteristic dysmorphic features, including upslanting palpebral fissures and single palmar crease, also called simian crease. Other classic findings include brachycephaly, flat nasal bridge, small low-set ears, epicanthal folds, and generalized hypotonia. These features help clinicians recognize the condition at birth, though karyotype confirmation is essential. A 6-month-old infant is referred to genetics clinic for global developmental delay and unusual facial features. Which facial feature is commonly observed in Down syndrome? Option A, long narrow face with prominent forehead. Option B, flat facial profile with depressed nasal bridge. Option C, triangular face with pointed chin. Option D, asymmetric face with facial nerve palsy. The correct answer is B. Down syndrome patients characteristically have a flat facial profile due to mid-face hypoplasia, combined with a depressed or flat nasal bridge. Additional craniofacial features include brachycephaly with flattened occiput, small mouth that may cause relative tongue protrusion, and overall reduced anteroposterior diameter of the skull. These features become more apparent with age. A 3-year-old child with Down syndrome presents for routine follow-up examination. Which musculoskeletal finding requires immediate evaluation and potential imaging? Option A, flexible flat feet. Option B, atlantoaxial instability with neck pain. Option C, clinodactyly of fifth finger. Option B, wide sandal gap between first and second toes. The correct answer is B. Atlantoaxial instability affects approximately 15% of individuals with Down syndrome and can lead to spinal cord compression. Warning signs include neck pain, gait disturbances, weakness, or bladder dysfunction requiring immediate cervical spine imaging and neurosurgery consultation. While clinodactyly, sandal gap, and flat feet are common findings, they typically don't require intervention. A newborn with confirmed Down syndrome undergoes physical examination. A systolic murmur is detected during cardiac auscultation. What percentage of patients with Down syndrome have congenital heart disease? Option A, 10 to 20%. Option B, 25 to 35%. Option C, 40 to 50%. Option D, 60 to 70%. The correct answer is C. Approximately 40 to 50% of individuals with Down syndrome have congenital heart disease, with atrioventricular septal defect being most common, followed by ventricular septal defect. Other cardiac defects include atrial septal defect, patent ductus arteriosus, and tetralogy of Fallot. All newborns with Down syndrome should receive echocardiography screening regardless of examination findings. Understanding the genetic basis of Down syndrome is crucial for counseling families. What is the most common chromosomal mechanism causing Down syndrome? Option A, Robertsonian translocation involving chromosome 21. Option B, trisomy 21 due to non-disjunction. Option C, mosaic trisomy 21. Option D, partial trisomy of chromosome 21. The correct answer is B. Approximately 95% of Down syndrome cases result from free trisomy 21 due to meiotic non-disjunction, creating 3 copies of chromosome 21. Robertsonian translocation accounts for 3 to 4%, while mosaic trisomy affects 1 to 2%. Advanced maternal age significantly increases non-disjunction risk during oogenesis. The phenotypic features of Down syndrome result from overexpression of specific genes on chromosome 21. Which chromosomal region is considered critical for the Down syndrome phenotype? Option A, 21q11.2. Option B, 21q22.1 to q22.3. Option C, 21p11.1. Option D, 21q21.1. The correct answer is B. The Down syndrome critical region, located at 21q22.1 to q22.3, contains genes whose overexpression produces characteristic phenotypic features. Key genes include DSCAM, DYRK1A, and AP. The amyloid precursor protein gene particularly contributes to early-onset Alzheimer's disease observed in adults with Down syndrome. A 28-year-old woman at 12 weeks gestation undergoes first trimester screening. Which biochemical finding pattern suggests increased risk for Down syndrome? Option A, decreased PAPA and increased beta-HCG. Option B, increased PAPA and decreased beta-HCG. Option C, normal PAPA and beta-HCG with increased AFP. Option D, decreased PAPA and decreased beta-HCG. The correct answer is A. First trimester Down syndrome screening shows decreased pregnancy-associated plasma protein A and increased beta-human chorionic gonadotropin, combined with increased nuchal translucency on ultrasound. Cell-free DNA testing offers 99% sensitivity. However, all positive screening tests require diagnostic confirmation through amniocentesis or chorionic villus sampling for definitive karyotype analysis. A term newborn presents with hypotonia, upslanting palpebral fissures, single palmar crease, and flat facial profile. Down syndrome is clinically suspected. What is the gold standard test for confirming the diagnosis? Option A, clinical examination alone. Option B, fluorescence in situ hybridization. Option C, chromosomal karyotype analysis. Option D, microarray analysis. The correct answer is C. Chromosomal karyotype analysis is the gold standard, identifying whether Down syndrome results from free trisomy, translocation, or mosaicism. This distinction is crucial for genetic counseling regarding recurrence risk. While fluorescence in situ hybridization provides rapid confirmation, karyotype offers comprehensive information. If translocation is detected, parental karyotypes should be obtained. A 6-month-old infant with Down syndrome has a large atrioventricular septal defect diagnosed by echocardiography. The child shows signs of failure to thrive and tachypnea. When should surgical repair of complete atrioventricular septal defect typically occur? Option A, within first 2 weeks. Option B, between 3 to 6 months. Option C, at 1 year. Option D, at 2 to 3 years. The correct answer is B. Atrioventricular septal defect repair should occur between 3 to 6 months of age in Down syndrome patients. They develop pulmonary vascular disease earlier than other children, making timely surgical intervention critical. Preoperative management includes diuretics, ACE inhibitors, and nutritional support. Postoperative monitoring focuses on residual defects and atrioventricular valve function. A newborn with Down syndrome presents on day 1 of life with bilious vomiting and progressive abdominal distension. Plain radiographs are ordered. Which gastrointestinal anomaly occurs most frequently in individuals with Down syndrome? Option A, pyloric stenosis. Option B, duodenal atresia. Option C, malrotation. Option D, Hirschsprung disease. The correct answer is B. Duodenal atresia affects approximately 12% of Down syndrome newborns, presenting with the classic double bubble sign on imaging. Hirschsprung disease occurs in 1%, representing a 40-fold increased risk. Other associations include imperforate anus and tracheoesophageal fistula. Additionally, celiac disease screening should be performed during childhood due to increased prevalence. A 4-year-old child with Down syndrome presents with 3 weeks of fatigue, easy bruising, and pallor. Complete blood count shows pancytopenia. Bone marrow aspiration is planned. Which type of leukemia has the highest relative risk increase in Down syndrome? Option A, chronic lymphocytic leukemia. Option B, chronic myeloid leukemia. Option C, acute myeloid leukemia. Option D, acute lymphoblastic leukemia T-cell type. The correct answer is C. Down syndrome patients have a 10 to 20-fold increased risk for acute myeloid leukemia and also elevated risk for acute lymphoblastic leukemia. 10% of newborns develop transient myeloproliferative disorder, which spontaneously resolves but requires monitoring. Interestingly, children with Down syndrome and acute myeloid leukemia have better treatment outcomes than general population. Parents of a 3-month-old infant with Down syndrome ask about their child's developmental prognosis and future capabilities. What is the typical severity of intellectual disability in individuals with Down syndrome? Option A, profound, IQ below 20. Option B, severe, IQ 20 to 35. Option C, mild to moderate, IQ 35 to 70. Option D, borderline, IQ 70 to 85. The correct answer is C. Most individuals with Down syndrome have mild to moderate intellectual disability, with IQ typically ranging from 35 to 70. However, significant variability exists between individuals. Early intervention programs, including physical therapy, occupational therapy, and speech therapy, substantially improve developmental outcomes. Most children achieve major developmental milestones, including walking, talking, and reading. A 3-month-old infant with Down syndrome and significant hypotonia is referred to early intervention services. The infant has difficulty with head control and trunk stability. Which therapeutic intervention should be prioritized initially? Option A, speech therapy for feeding difficulties. Option B, physical therapy for motor development. Option C, occupational therapy for fine motor skills. Option D, behavioral therapy for social skills. The correct answer is B. Physical therapy should be initiated first to address hypotonia and support gross motor development. Early physical therapy intervention optimizes achievement of motor milestones, including head control, sitting, and walking. As the child develops, occupational therapy for fine motor skills and speech therapy for communication are added. A comprehensive multidisciplinary approach coordinating all therapies produces optimal outcomes. A 5-year-old child with Down syndrome presents for routine health maintenance visit. The child is doing well developmentally and has no acute concerns. Which screening test is recommended annually for school-age children with Down syndrome? Option A, cervical spine X-rays. Option B, echocardiography. Option C, thyroid function tests. Option D, chest X-ray. The correct answer is C. Annual thyroid function testing is recommended because hypothyroidism affects 15 to 30% of individuals with Down syndrome. Additional surveillance includes hearing assessment every 6 months until age 3, then annually, annual vision screening for cataracts and refractive errors, and celiac disease screening starting at age 2 years. Comprehensive health supervision is essential. A 7-year-old child with Down syndrome presents with loud snoring, restless sleep, and daytime hyperactivity. Parents report the child stops breathing during sleep. What percentage of individuals with Down syndrome have obstructive sleep apnea? Option A, 10 to 20%. Option B, 30 to 40%. Option C, 50 to 75%. Option D, 80 to 90%. The correct answer is C. Obstructive sleep apnea affects 50 to 75% of individuals with Down syndrome due to midface hypoplasia, adenotonsillar hypertrophy, obesity, and hypotonia. Polysomnography is recommended by age for years even without symptoms. Treatment options include adenotonsillectomy as first-line intervention, continuous positive airway pressure therapy, and weight management strategies. A 12-year-old adolescent with Down syndrome presents with 6 months of progressive weight gain, constipation, and fatigue. Examination reveals dry skin and delayed relaxation phase of deep tendon reflexes. Which thyroid disorder is most commonly observed in individuals with Down syndrome? Option A, hyperthyroidism. Option B, hypothyroidism. Option C, thyroid cancer. Option D, thyroiditis. The correct answer is B. Hypothyroidism occurs in 15 to 30% of individuals with Down syndrome, either congenital or acquired. Autoimmune thyroiditis becomes more common in older children and adolescents. Presentation may be subclinical with only elevated thyroid-stimulating hormone or overt with clinical symptoms. Treatment involves levothyroxine replacement with regular monitoring to maintain euthyroid state. Parents of a newborn with Down syndrome ask about long-term prognosis and life expectancy. They want to understand what the future holds for their child. What is the current median life expectancy for individuals with Down syndrome in developed countries? Option A, 30 to 40 years. Option B, 40 to 50 years. Option C, 60 years. Option D, 70 years. The correct answer is C. Current median life expectancy for Down syndrome is approximately 60 years, representing dramatic improvement over recent decades due to advances in cardiac surgery and medical management. Adult considerations include increased Alzheimer's disease risk after age 50, employment opportunities, and independent living arrangements. With appropriate medical care and social support, most individuals lead fulfilling, productive lives. Thank you for watching this comprehensive lecture on Down syndrome from Pediatric Case Review. We covered clinical features, diagnostic approaches, complications, and evidence-based management strategies. Early detection, multidisciplinary care, and family support optimize outcomes. Please subscribe to our channel for more informative medical education presentations and leave your questions in the comments section below.